Go.
But one of the things that still bothers me is, like, once they discharge you from the cancer hospital care, there's not a lot of support out there, I find.
What kind of support do you feel you needed at that point?
When I finished, like, my medication that I was on, I thought, oh, now what? You know, it's quite a loss, a feeling of loss, when you all of a sudden stop this one medication, which is probably, you know, going to increase your chance of survival by, you know, not 100%, that's for sure, but it does increase it. But then you have sort of no protection, you're not getting any treatment and things like that. I found that was quite hard for a while, till I thought, oh, well, you know, whatever, that's how it is.
But it just kind of stops. And
it just stops, bang. Yeah, and I found that was hard.
So there's no follow-up with your physician after that, or it's just...
I was fortunate that I had a really good physician, and she, because my breast cancer was never found through mammograms and ultrasounds and things like that, and even an MRI and things like that really didn't show it. Which I forgot to mention that I had had an MRI. But, you know, it was through my own breast exam that I found it. And so she agreed to, you know, for me to have breast exams every 3 or 4 months. And so that was good. And it's just, you know, I sometimes would like to have someone to talk to a little bit about, you know, what now? At what point do you ask if you can have, like, a bone scan or CT scan, and is this kind of stuff normal, or is it necessary, or is it more like a paranoia thing? And yeah.
So that kind of checking in every once in a while.
Yeah.
So what's your normal pattern now? Do you go back to your family physician when you want to, or?
Yeah, I still go, you know, every 3 to 4 times during the year to have a mammogram.
Okay.
And then I do go to the cancer hospital and have an ultrasound and a mammogram too, once a year. So that's good. There's some people that I know, and I wish I was one of them. They're on a study, and so they see a doctor every 3 months, and you know, have blood tests, and then have different tests and things like that. And I'd like to be one of them. Yeah.
What would be different for you if you were one?
I think then you just have a little bit more reassurance that nothing is creeping up, getting too involved in your body, I guess. Yeah.